I've been an athlete all my life, doing a variety of different sports, and gymnastics I did. I've been doing martial arts now for 20 years, and swam. I was a lifeguard, and you name it, except things like bungee jumping or anything to do with heights other than hiking. I've pretty much done, you know, just about a little bit of everything, and I love it. I love hitting things, stress relief. Um, Arts. I tore my ACL, which is a common sports injury. You wouldn't think something like that would ruin your life, but I wasn't exactly the most perfect patient. I was very eager to get back into sports after the uh, ACL tore, and it tore and literally floated away. I didn't have one for about 6 or 7 months before we did the surgery. And I eventually had 4 knee surgeries, 2 ACL reconstructions, and 2 meniscectomies. One where they just did the suctioning and cleaning out, and then the other one they actually had to stitch it up. And that was way back. Those surgeries dates back to 95, 96. And so anyway, as the years go by, I continue to have problems, with exercising, with my job, doing charting, having to, squat down to the bottom and standing up, so doing squats, and my martial arts and weightlifting and things like that just were a constant bother. It wasn't severe pain, but it was troubling enough for me to complain about it and make a fuss. And so I had another meniscectomy, and it was kind of an exploratory surgery, but the doctor thought he was going to need to do more work on my ACL, but when he went in there, he just discovered that I really didn't have a meniscus left. The cartilage just had been worn down to nothing, where it was pretty much bone on bone at that point, and I was looking at a bright future of a knee replacement. So I was in the low percentile of people, though, who were eligible to get a transplant. That's when I started developing the symptoms for CRPS. My knee turned purple and pink and all kinds of weird colors, not just the bruising. It was different. It didn't look natural, and it would be very hot to the touch, and my foot would be white and ice cold, and it would be painful just to have the cast on it. And I was on crutches for 11 weeks as opposed to 6, and I began to lose weight. I couldn't keep down food. I dropped 50 pounds, or 55 pounds actually, within a year. So I looked sick and skeletal, and my family was really concerned, but and the doctor had actually thrown out the acronym RSD, but there was a lot of things being thrown at me, and I didn't think it was a big deal because the doctor didn't think it was a big deal. So I didn't get proper treatment. I was sent to a pain clinic, and that doctor was not interested in helping me find what was going on, because a year goes by, or nearly a year, and my knee had healed up very bent, so I couldn't walk heel to toe. I ended up having to go on a cane for several years. And in 2010, in October, 10 months after the transplant, the doctor went back in to try to straighten out my knee, and that's when the CRPS symptoms just absolutely exploded. The pain was unbelievably intense, and again, with those symptoms, I had the discoloration, the fevers, and air touching it. The physical therapist tried dry needle therapy, and it did put me on the floor. I remember I tried to go to work and then to physical therapy and then come back to work, and I was in tears. I was in so much pain, and I'm not a crybaby or a wimp or anything. When I first had the ACL snap, that was some of the most horrific pain in my life, and I held it together and didn't scream out or anything. At that time, I toughed it out, and because I was a martial artist, that's what you're supposed to do. And it took me waking up with half of my body down the center line from head to toe. Woke up and it was numb, and I believe it was the right side. I'm not sure on that, but I thought I had a stroke, so I freaked out and called my neurologist. And I was talking to him about all the symptoms that I had, the illness, the weakness, the tingling, the loss of circulation, and it was all on my leg at that point. Hadn't spread. And so my neurologist recommended that I go to a pain doctor that he saw for pain block injections. He was getting them in his neck. So he's a very good doctor, and I trusted him, and so I went to this new pain doctor who suspected but wasn't familiar with CRPS or RSD, but the symptoms kind of rang a bell with him. And after we did 7 nerve blocks, I think, and I lost count. When I saw Dr. Rollins, he explained to me that the condition I had, RSD, they did blood tests, and it's not really something you can diagnose with a blood test. It's pretty much symptomatic only, but I told him that it was so similar to when I had the shingles, and so anyway, he told me that with my condition, you have about a 3-month window before for the ketamine to work, and it's been 2.5 years at this point, so we didn't think that the ketamine would do anything, but I was willing to give it a try, and I put my body through hell. And I'd watched videos on the internet, and where this girl who was in a wheelchair from CRPS went into a ketamine coma, and she woke up and was all better, and but the ketamine seemed to light up the RSD. I didn't react well to it at all. Even during the treatment, it puts you in this very weird euphoric state, and it was indescribably crazy. The hallucinations, the auditory hallucinations, the visual, it was just. I hated it. It was miserable, and then on top of that, it made you feel like you had the stomach flu afterwards. you get violently ill. And so, but you know, the CRPS is so intense and painful. You're willing to do anything to get rid of the pain. But you know, I just wanted to emphasize, especially those who have had shingles before, or who are women who have had an injury, and you start developing these symptoms. You know, the sharp, intense pains, shooting pains, throbbing pains, achingness, a weird rash, like I've got one on my elbow. It's kind of scaly, can't really see it, but you get these little bumps, and it feels very dry and scaly, and no amount of moisturizer helps at all. And believe me, I've tried even today. But the sensitivity to clothing and light touch, like I've got that going on right now in my right arm. Numbness, poor circulation, that leads to more problems. And then, of course, you know, the achingness, the swelling of the joints, the discoloration, any of these symptoms are just, it's really critical to get early diagnosis. That's very very important. So anyway, that's in a nutshell how this happened. And like I said, the shingles is probably the why that, and I had surgeries back to back to back, you know, just a few years after my spinal cord had been attacked by the herpes zoster virus. So I guess bad luck. But so just be aware of your body, and you know, don't go crazy over it. Don't let it ruin your life, and just try to keep it on. That's all we can do. Take care, and thank you everybody for helping me and for giving your time and attention and for caring. That's all we can hope for. Thank you so much.